So for decades, we have been using mouth rinses, antiseptic mouth rinses, and the best ones are those based on chlorhexidine and CPC to help us in controlling bacterial biofilms around teeth. So we were able to improve periodontal health, and we were able to help in the prevention of periodontal diseases. Today, and together with this impact that we know, we have understood that they may reduce the presence of viruses in persons that have been infected. So that could also help us in promoting health. We should not forget that the main focus or the main objective of these mouth rinses is controlling bacteria within dental biofilms, but evidence is telling us that it may help us also in controlling viruses.
This is a simple means of reducing the risk of the virus in the saliva. And well, there's products like, for instance, like chlorhexidine and CPC, which have antibacterial and antiviral properties. So I think it would be good to have your patient rinse in advance before performing an aerosol generating procedure.
I think we can distinguish between pharmacological measures and non-pharmacological measures. When it comes to pharmacological measures, I think the new vaccines adapted to present variants will be very important. These vaccines should be more effective against the BA.5 variant of Omicron, for instance. But since new variants will always evolve, it is also important to keep in mind the non-pharmacological measures like social distancing, if necessary, triages, or facial masks and mouth rinses.
I think this is a very worthwhile preventive measure because we know from clinical trials that there is definitely an effect on the bacterial load and also maybe on viral load when it comes to herpes viruses or influenza viruses. And the recent clinical data also gives hints that there may be some effect towards SARS-CoV-2. So pre-procedural mouth rinsing can help at preventing transmission of infectious diseases and maybe even more worthwhile than using antiseptics for instance, in period treatment or so.